Hello friends, my name is Allie, and today we're going to be delving into the healthcare topic of breast cancer and its global impact through policy and patient-centered care. Now, what is breast cancer? According to the National Cancer Institute, breast cancer develops when cancerous tissue begins to grow in the breasts. This could cause life-altering effects, especially if it metastasizes or spreads to other surrounding tissues and organs. According to the American Cancer Society, 1 in 8 women will be diagnosed with breast cancer in the U.S., and as of 2022, 2.3 million people worldwide will be diagnosed with this malignancy. There are several federal policies to aid in the treatment and prevention of breast cancer. The National Breast and Cervical Cancer Early Detection Program is a CDC-funded project that provides early diagnostic screening to people that are not able to afford this preventative health care, including uninsured and marginalized communities. The U.S. Preventative Service Task Force establishes guidelines and communicates the best practices for screening for breast cancer. Current recommendations are to receive a mammogram every other year from ages 40 to 74 for cisgendered women and people assigned female at birth who are at average risk for breast cancer. To fully grasp breast cancer's global impact, we're going to explore another country's approach at the treatment and management of this disease. The nation of Canada has been chosen for this exercise. Canada runs on a publicly funded healthcare system, providing its citizens the financial opportunity to utilize preventative screening and treatment once diagnosed. The Canadian Task Force on Preventative Healthcare focuses on screening of cisgendered women ages 50 to 74, not at high risk for this malignancy. While they don't recommend screening before age 50 for low-risk individuals, the Canadian Task Force on Preventative Healthcare encourages shared decision-making and believe if a person wants a mammogram, they should have access to it. Strengths of the United States healthcare policy is that they include gender nonconforming individuals into their definitions and recommendations for breast cancer. The U.S.'s programs are built to help marginalized communities navigate the complex and costly prevention and treatment of breast cancer. Unfortunately, there is little vocabulary in these policies surrounding creating individualization and unique breast care treatment / prevention plans for citizens. And due to not having a publicly funded healthcare system, the cost of treatment and prevention is greatly determined by a patient's healthcare coverage. Strengths of Canada's healthcare policy is that citizens' cost of prevention and treatment is covered due to their publicly funded healthcare system. While travel and time off work expenses still apply, the financial weight being carried equitably by each citizen allows people diagnosed with breast cancer to focus on their treatment instead of paying for it. Canada also strives to create a unique plan for treatment and prevention for each patient. The biggest weakness in Canada's policies is they have not been updated to include gender nonconforming folks, and this exclusion could lead to a large group of citizens not wanting to participate in preventative screening or not being educated on breast cancer. There are 3 main improvements that could elevate the U.S. healthcare system's policy surrounding breast cancer. 1, adding the requirement of creating an individualized approach to prevention and treatment of breast cancer will increase the efficacy of prevention and/or oncological interventions. 2. Since the U.S. does not run on a publicly funded healthcare system, creating more grants for research, treatment, and prevention is necessary to combat this disease. Finally, sending funding and resources out into the community to bring breast cancer screening through pop-up clinics or mobile clinics will increase the necessary access required for early prevention. To address the economic impact of breast cancer, the U.S. runs the National Breast and Cervical Cancer Early Detection Program, which focuses on early spotting of the disease. The earlier breast cancer is detected, the less invasive treatments and procedures that have to be used. There is a decrease in complex complications, which leads to a lower economic impact on the patient and country as a whole. To combat the negative health consequences that come with breast cancer, the Breast Cancer Research Program focuses on primary prevention strategies like routine mammograms, determine who is at high risk of developing breast cancer, strives to decrease overdiagnosis, and investigates the metastatic nature of breast cancer. Now, what's Canada's approach? Alongside their publicly funded healthcare system, Canada has also created a healthcare navigator to help organize patients' financial aids and educate breast cancer patients on how they should prepare for treatment, how that treatment can form a barrier between school and work, and how to overcome those subsequent barriers. To address the health consequences of breast cancer, the Canadian Minister of Health allocated money to the Canadian Partnership for Tomorrow's Health for a project aimed at increasing breast cancer screening, and the Canadian Cancer Society to generate public awareness through social media around breast cancer. Breast cancer management and treatment fit right into multiple sustainable development goals. For example, providing accurate and equitable preventative screening and treatment for breast cancer gives people a greater chance of fighting this disease and taking back their health and well-being. Breast cancer is diagnosed more in women, and having a solid understanding of the gender impacts, including judgments regarding these women's ability to juggle treatment and a career, and the inclusion of gender nonconforming folks to ensure the success of decreasing the impact of breast cancer, makes it a gender equality task. Finally, breast cancer demands extensive, time-sensitive, and time-draining treatment that require time off work, creating a possible barrier for economic growth. Understanding this phenomenon is the only way to accomplish this goal. Understanding the financial burden of breast cancer diagnosis or even the preventative screenings have on patients will push me to work alongside my patient to generate the most cost-effective healthcare plan possible. Medicine grows and changes constantly, so staying current on the best evidence-based approach for breast cancer screening and treatment will improve quality of care given to all my patients. Finally, being aware of the time and financial barrier that comes with a breast cancer diagnosis will allow me to create the best plan of action for each patient. There are many ways I can advocate for patients and their breast health. 1. Educating patients about breast cancer prevention and treatment at their level of comprehension will increase the amount of citizens that have power through knowledge regarding this disease. 2. Being involved in policy creation that improves access for patients to receive these vital primary prevention strategies will save countless lives. Finally, Being active at the polls and voting for politicians that have proved through their actions that they have patients' best interest at heart is a simple yet effective way of advocating for change. Thank you so much for going on this global health journey surrounding breast cancer with me. I hope analyzing America's policies and comparing them to other approaches around the world sparked a vibrant discussion and gave you some ideas on ways to improve the healthcare quality in your community. Thanks for listening. Bye.